Good afternoon, Scurry County. County Judge Dan Hicks here, and I'm sure you know this gentleman's face. You may not know his name, but it's Jonathan Farmer. He works here at United Manager, correct?
Yes, sir.
Yeah. Then you said you've been here for 6 years.
Yes, sir.
We're going to get into it with Jonathan here a little bit about United here in just a couple of minutes, but first I want to go over your daily numbers, and then I'm going to talk just a little bit about what the governor has said today, and then we'll talk to Jonathan. All right, in Texas, we've had 242,547 tests, 242,547. Currently in the Texas hospitals, we have 1,674. We have 21,944 cases reported. We have 593 fatalities in the state of Texas. I'm sorry, I'm giving you the wrong numbers. Let me go to the other side. Texas tests 290,517. I got distracted thinking about my phone there when it was ringing. Currently in the Texas hospitals, we have 1,563. Cases reported is 25,297. We have 663 fatalities. Patients recovered is 11,170. And we still only have 254 counties reporting. In Scurry County, we've had 156 tested. We have 13 pending, 141 negatives, and we only have 2 positives still. So that's where we stand as far as the state and Scurry County is. If you remember, I told you that National Guard is going to be coming in on Wednesday to do some testing. You can find the information on where to go to get the testing and the number to call on the Facebook page, on the web page, at the Extensions Office page. They're doing a lot of help with all of this. Any page that is a government entity in the Scurry County, you can find it on their page, and that you can get the numbers there. All right, so today the governor said that he is going to start opening up Texas. The order that he put out that expires on the 30th will expire. He's going to go into what he's calling phase 1. It's going to be effective May 1st, and he's going to allow some places to open. He's going to allow all retail to open up, restaurants, theaters, malls, and whatnot, and they're going to limit capacity to 25%. Smaller counties like us that have had 5 or fewer cases, he's going to allow us to go to 50% occupancy on those restaurants and whatnot. We'll have more information on all of that tomorrow. He also said that his order supersedes all local orders, so we have to take that into our thoughts when we get into it. So we'll get some more into it tomorrow. He's going to allow outdoor sports, 4 participants or less, golf and tennis. He mentioned those. Doctors, nurses, and dentists, he's going to allow those to open back up some too. So we'll get into more of that tomorrow. Jonathan, so you've been here for 6 years, and you're the manager at United. Man, you've seen a lot in the last couple of months, haven't you?
Yes, sir. It's definitely been an experience. There's really no playbook for this, so yeah, we've kind of had to learn on the fly and make some pretty quick changes.
Absolutely. And so, like we were talking about earlier, it all started with toilet paper. It was flying off the shelves.
Yes, sir.
And you said right after spring break is when it really hit, that your shelves really started emptying out, right?
Yes, sir. Around that March 18th mark, sometime in there, that's when we started to experience some pretty large outages.
Yeah. How did that come about? Was it just, and what were y'all expecting when it hit? Were you expecting anything like that, or was it just totally out of the blue?
You know, I think for us it was totally out of the blue. Of course, you know, we had heard rumors, and you never know how the public is going to react to things like that. And so we were just overwhelmed. I think the entire industry was overwhelmed. That's why it's taken so long to get our stores back in stock, is because of national shortages.
Absolutely. Yeah. So what have y'all seen since then to now?
Since then to now, you know, things just have steadily caught up. Our manufacturers are catching up. Some manufacturers have limited their production. So if they maybe produce 25 items for our stores, they may cut those to their top 3 items. And so they're only producing 3 items instead of the 25 you had before. So if you see less variety in the stores, there's a reason for that. They're just trying to keep up with those core items that they have. And eventually, hopefully, we'll see those other line items come in into
Right.
our stores.
Yeah, and we were kind of talking about the meat industry, how they've been impacted by, some plants have gotten hit really hard with COVID. And so we might see some effect there, but you don't think it's going to be as too awfully bad.
No, sir. I think we are going to see some shortages in meat. I think we may see a little more limited options available, kind of like what we've seen over the last couple of months through some of this period where they sort out what's going on in these packing places. But I don't think we'll have any long-term shortages.
Okay. Where do you see us going in the future?
Gosh, in the future, I hope we kind of just figure out what the new normal is. I think that's what we're trying to do, is just kind of figure out people's shopping patterns have changed, the things they're buying have changed, the times of day they're buying those things have changed. And so for us, I would just like to kind of hopefully, as we open back up our economy, kind of get to figure out what that new normal is going to be so that we can make the right decisions to go along with that.
Absolutely. Now, throughout all of this, we've seen some different changes in the store as far as the shields at the checkouts, one way in the aisles, which I'm really impressed with, because I'm not one that'll look down at the floor. And most people I've realized don't look at signs, but I've been in there and I've seen people look down and go, "Oh, I'm going down the wrong aisle," and go down the next one. So you've got everybody wearing masks, and you're counting how many people are coming in and out. And so y'all have made a lot of changes. What all have you done that we're not necessarily seeing or realizing?
Beginning it before the store even opens, we begin by screening our team members. Mm-hmm. So we have a series of questions that we ask just to make sure we know what kind of possible exposure they've had. We also, starting tomorrow, will be taking temperatures of our team members as they come in to start the day, so that maybe they don't notice that they're experiencing some of those symptoms, but we can help recognize them and help them to, find the right path to go from there. Once you enter the store, of course, like you said, we're wearing face masks. We have someone sanitizing our shopping carts from the time that we open until the time that we close. We also have someone there from the time we open until we close, just going around the store, just sanitizing places that we know are frequently touched in the store. We've reduced the number of displays that we have in the store so that provides more room for social distancing, as well as the arrows on the aisles to make sure that we can kind of do that, which has been a challenge for myself. Even I catch myself going the wrong direction sometimes, but I think it has been making a difference.
Absolutely, and I think you're right. And I like hearing the announcement. You're asking the checkers to sanitize their stations.
Yes, sir. We make that announcement every half hour.
Okay.
And so our cashiers are supposed to finish the transaction they're working on, and then take a moment to sanitize the pin pad that the customers touch, as well as anything else on that counter that might have been touched.
Okay. That's very good. So what else is going on? I know there were some things that you wanted to discuss.
Well, I just wanted to take the opportunity to say thank you to Scurry County residents, to our local businesses. The outpouring of support that we've had it's just almost unimaginable. We've had everything from people making face masks for our teams to just coming by with encouraging words. We don't have enough time in this segment to mention the people that have brought food and supplies to the stores to help out. And so I just want to express my gratitude to all the wonderful people here in Scurry County and all the great things you've done for our team. And I also want to take a moment to thank our team, because, they didn't sign up for this either. It's just something that kind of happened.
Absolutely.
But they have not faltered, not once. They're here for every shift and happy to stay longer hours or whatever our needs may be.
Yeah, and that's the other part of this, is they're right there on the front line, and you're on the front line. It's a lot like, I'd say it's a lot like, in a different aspect, it's a lot like the doctors and nurses and all that have to deal with possible infection where they're at. Your people could get infected as well, and they're doing everything they can to protect themselves and to protect others, and they're still showing up every day, knowing that it's a possibility that as much as this spreads, they could get it too. So.
Yes, sir. I think they just know that that's their duty to serve our community, and how important it is that everybody gets food. And so we didn't even have to ask. It's just something that everybody jumped on board, and they just understood that that was something that they needed to do. And so I couldn't be more grateful.
That's good. That's good. I'm glad to hear that. We were also discussing the senior days. There was a lot of publicity early on for it, but there's not so much anymore. So we wanted to remind people that you do have the senior days where those that who could be most affected can go in at a certain time on a certain day. What are those times and days?
So on Monday and Thursday morning, 60 plus, and then anybody else that may have a compromised or weakened immune system. Those are designated. Those times are designated for those particular people. When we first began that, there was a lot of social media. There was a lot of television spots about that, and so I know that a lot of our senior shoppers know those times really well. But I think other people have kind of forgotten about it. So it's great, I think, for us to respect that time for them to come in and be able to get the things that they need and not have the big crowds.
Yeah, and so it's not, this announcement isn't just for those seniors that want to use that time. It's for those of us who are not in that position to kind of stay out and let them have that time to go in and not worry about getting infected. Now we are reopening, and we still need to remember that we are probably going to have these guidelines. We're in a good place right now. We haven't had we've had the 2 cases, but they're negative now. But we don't want to end up going backwards because that can cause all kinds of problems for us. So we also talked about the senior center, how they're volunteering to get the groceries for some of these folks as well.
Yes, sir. Yes, sir. Right now, Monday through Friday, the senior center is taking orders by telephone. And so for seniors, you can call in and they will take your list down. I believe the hours are 8 in the morning until 11 in the morning is when they're taking orders. In the afternoon, they're shopping for those orders and they're delivering them right to their doorstep. So what a great service that they're providing. And we're so grateful for their partnership in this.
Absolutely. Yeah, thank you. All right. Well, is there anything else that you wanted to cover today?
I think that I'll get it.
Okay. I'm so glad you came today, Jonathan. He is a hero, guys. If you see him, tell him thank you because he's doing a great job for us here at United. Thank you, Jonathan.
Thank you for having me.
You're welcome.